At the Olivia Newton-John Cancer Centre, I am an autologist, bone marrow transplant coordinator and a Haematology Survivorship Nurse Consultant. So I have a dual role. Majority of my role is the autologous bone marrow transplant nurse, but we also have a robust haematology survivorship clinic, which I developed here about 3 years ago. And we see patients who completed treatment for a haematological malignancy. So they may be patients with curative intent or patients treated for intending a long-term remission. And we also see all our bone marrow transplant patients. So that's our autografts, meaning they've had their own stem cells, and our allografts, which is a growing service here. And they're the bigger transplants where they've received either an unrelated donor or a sibling's stem cells or bone marrow. And they have unique needs post-treatment completion. So we see them all through our survivorship clinic. I think I've had many years as being a haematology clinical nurse. And through those years, you really become inspired and start questioning major issues around patient follow-up. So in particular, I used to always think, how do patients adapt to life post-treatment completion? How do they go through all this toxic treatment, the uncertainty, the difficulty in returning to normal? How can they put that all together and move on? So, having research to better support patients and have evidence-based interventions to support patients post-treatment completion has become my passion. Research that I'm currently involved in, we have had opportunities through our survivorship clinic to run survivorship projects and research projects, mainly funded by the Victorian Cancer Survivorship Program. We ran a brain training or a intervention to support patients describing cognitive decline post-bone marrow transplant, and that had a brain training intervention post-bone marrow transplant for patients to implement at home. And we undertook evaluation at 4 time points as they undertook that evaluation. And very recently, the research we're involved in is a project called Recharge, which is a fatigue online management intervention for patients describing fatigue post-treatment for haematological malignancy. Once again, supported by the Victorian Cancer Survivorship Project and led by the Alfred Hospital, and we're a collaborative site. The impact that research has had clinically is it's great as a clinician that patients come describing these problems or issues that they're experiencing post-treatment completion, and you have actually something to recommend to the person to undertake. Because symptoms like chemo brain or cognitive decline and fatigue, it's been difficult as a clinician to actually have something to recommend to put in place. So this is giving the patient evidence-based interventions or guidelines how better to support them post-treatment completion. So it's very rewarding for the patient and their family, and also the clinician.